Hi, I'm Dr. VidyaTickoo, endocrinologist at Park Endocrinology, Hyderabad. So today I'll be discussing if diabetes and PCOD are interrelated. If you have diabetes, can you have PCOD? Or if you have PCOD, can you have diabetes? Or if your parents have diabetes, are you at risk of having PCOD? So the answer to all these questions that I just asked is yes, yes, yes and yes. If you already have diabetes, you are at risk for PCOD. So basically what happens is that the mechanism, the disease mechanism for diabetes as well as for PCOD is same. It is insulin resistance, that is your body is making insulin but is not able to utilize that. So insulin basically causes the cells to utilize glucose, and glucose is something which is required for anything we do. I'm talking to you, it requires glucose, it requires energy. I'm breathing, it requires glucose. So when insulin cannot act, that is when there is insulin resistance, this glucose does not enter the cells. So it keeps on increasing inside our blood, causing increased blood sugar. That is your diabetes basically. The same mechanism, so this is insulin resistance causing diabetes. The same mechanism happens at the level of ovaries as well. So in ovaries, female hormones like FSH and insulin act together every month, so that one egg develops and comes into the fallopian tube. If there is insulin resistance at the level of ovary, that one egg doesn't mature, multiple eggs are arrested in their growth stage, hence multiple cysts, polycystic ovaries develop. So the mechanism is same, insulin resistance at the level of pancreas, liver, fat, muscle causes diabetes. Insulin resistance at the level of your ovaries causes PCOD. So the mechanism is going to be same. So that is why if you have PCOD, already there is a very high risk that you have insulin resistance, hence you can develop diabetes. That is why if you have PCOD, get screened, check your sugars. You can check your fasting sugar, 2 hours after food sugar, HbA1c and blood levels of insulin as well. With that we can find out. Suppose sometimes what happens is that the sugar levels are normal because our body tries to compensate. Sugar level may be normal but insulin level in the body will be very high. So we calculate, in such patients we know that even though sugar is normal right now, in next 3 or 4 years they can enter into diabetes. But if we start lifestyle modification early on at this stage when your sugar is still normal, you might not enter into that category of diabetes for next 10 years also. So that is the importance of knowing your insulin levels also. So that is how PCOD and diabetes are interconnected. Now what can you do to prevent? Again, a lot of people ask if their parents have diabetes, are they at risk of having diabetes or PCOD? Then yes, diabetes has a genetic component. So if your parents have diabetes, if one parent has, the chances are that you will be at risk. If both parents have, the chances are even more that you will have diabetes or PCOD or both. So you need to be very careful, and the main thing is you have to maintain your ideal body weight, that is your weight by height should be below 23.5. As long as you are doing that, the chances that you will develop diabetes are less. They are not zero, but if you don't maintain that ideal body weight, the chances that you will develop PCOD and diabetes will be high. Once you maintain ideal body weight, the chance is definitely reduced. So maintain that ideal body weight, that is most important. How you can do? So there are certain changes in your diet that you can make if you have PCOD or if you have risk factors for PCOD, that is if you are overweight or if you have family history of diabetes or PCOD, and if your periods are irregular. So if you already have these risk factors, what you can do so that you don't develop PCOD or diabetes? So in diet, what you can do is reduce the carbohydrate. So carbohydrate is something that is present in, especially in our Indian meals. Whatever we eat, we end up eating 80% carbohydrates in our diet. So how you can reduce it is that instead of tiffins that we usually eat are idli and dosa, bonda, vada, instead of all these things which are basically made up of rice, you can shift to healthier options. You can shift to pesarattu. It is made up of pappu basically. So pesarattu is a good option, oats are good option, ragi is a good option. So you can make, nowadays there are so many YouTube videos for all these recipes. You can make idli and dosa from ragi, from jonna, from oats, from millets, koralu. Again, a lot of people are now aware of the healthy things. So again, in millets also Korolu is one of the best millets that we have, and you can prepare idli and dosa from that as well. So that is one thing. For lunch again, don't fill half of your plate with rice. That is one of the common things that we do. Eat very less rice. Ideally what we say is, if in that round plate, divide it into 4 parts and keep rice or chapati, that is carbohydrate, just in 1/4 part, just in 1/4. The other 1/4 should be some protein. So protein includes pappu, sambar, rajma, chole, meal maker, paneer, if you're a non-vegetarian, chicken and fish as well. And half of that plate should basically have vegetables. In vegetables you can have salads like kheera, onion, tomato, or you can have lots of curries. Most of the curries are good. If you are diabetic, you should avoid potato, beetroot, sweet potato. Rest everything, green leafy vegetables and all are basically very good. So you can have most of these foods. Along with that you can have perugo leda majjiga. Again in the night, if you are a diabetic, specifically we say not to have a lot of carbohydrate, because if you have a heavy dinner, which is most common, like after finishing a hectic day at office, entire family gathers and the heaviest meal of our days usually are dinners. But it should be the opposite. Our dinners should be very light. Try to finish your dinner before sunset. That is our old Indian way, and that is the best way. Try to finish it before the sun sets, at least before 7:30 or 8 o'clock. And again, try to have healthy options. Try to have fulka, jonna roti, such things, along with lots of curries. And as I mentioned, for lunch, same, divide your plate into 4 parts and have other things, salads and all, much more. In fruits, again, try to have fruits rather than having juices. If you are a diabetic, you need to avoid certain things like mango, banana, sapota, sitafal, green grapes. Again, not completely, but you can consult an endocrinologist and we'll tell you how to eat even mango if you are a diabetic during mango season. A lot of our patients come and say that they love mango and they cannot live without it, but they have diabetes and how can they eat it? There is a way you can eat mangoes. You can come to us and we'll just give you a chart just for that as well. So that is how you can modify. We never tell you to stop completely anything, but according to how your blood sugar levels, if you have not so severe diabetes, if you have mild diabetes, we can make things for you in which you can enjoy food items as well, but of course everything in moderation, nothing in excess. Other than that, half an hour of physical activity, which can be as simple as a walk, but it should be a very fast walk. You should sweat and your heart rate should go up. So half an hour of walk daily is going to help a lot in preventing a lot of things like diabetes and PCOD, and if you have it, to maintain the blood sugar levels as well. So this is what my message will be. If you have PCOD, the central part to your management is going to be your food habits and your exercise, and then based on your symptoms, different symptoms, we give you treatment specifically for those symptoms based on that. For any PCOD or diabetes related query, you can contact these numbers for Park Endocrinology, Hyderabad.